you men, you don't take care of yourselves and you know it. Wifey bugging you to get a checkup. Well, Dr. Dhiren Dave, urologist at New Jersey's Somerset Medical Center, is here to tell you why you ought to listen and do what she says. Good morning, doctor. Thanks for joining us.
Good morning, Brian. Thanks for having me.
I would imagine you urge a lot of your male patients, come on, you got to get in here sooner and more often.
Absolutely. I think prostate health is very important. We recommend screening for conditions such as prostate cancer. The prostate, as you know, is a gland that's located at the base of the bladder, and in men it serves the purpose of producing fluid that's part of male reproduction. Incidentally, also the urethra, which is the channel that men pee through, goes right through the middle of the prostate, and as men get older, the prostate can enlarge and it can cause compression of that urethra, making it a little bit more difficult for patients to urinate.
Right. Now let me ask you this, and we got to keep it family friendly here, but,
Sure.
but this is something that's common among a lot of men, and we tend not to go to the doctor until something's really wrong. And I would imagine you've got to urge your male counterparts, so look, just get in earlier. We can address this.
Absolutely. The conditions that affect the prostate are very common. Prostate cancer is one of the most common cancers that occurs in men. And
treatable.
Very treatable. 1 in 6 men will get prostate cancer in America, and it remains a cancer that, if detected early, can be diagnosed and treated.
As I read about this, that this is more prevalent among men of color.
Absolutely. There's several important risk factors for prostate cancer. Age, 65% of men with prostate cancer are over the age of 65. African Americans have not only a higher risk of getting prostate cancer, but a higher risk of developing a more aggressive form of the disease. Family history is also important. If you have a first-degree relative with prostate cancer, it raises your risk from 1 in 6 to 1 in 4.
Wow.
And additionally, something that's not as well known, the link between diet, obesity, and a high-fat diet have been shown to also increase the risk and increase the risk of developing an aggressive form of the disease.
Are there certain kinds of dietary measures you can take? I've read tomatoes, lipocene,
Right.
Is that
Lycopene, correct. There's a lot of things out there in the literature. The difficulty with interpreting some of the literature for the effects of nutrition on prostate cancer comes from some of the studies are difficult to interpret. There's conflicting results. In general, what I explain to my patients, a diet that's high in fruits, vegetables, whole grains, fish, low in fat, and low in red meats, I think is probably the best way to go. It's probably better to get your supplements, your nutrition from whole food rather than actual supplements.
Right.
Because we still don't understand the interaction between various nutritional components and their benefit for the human body, and that's where eating whole food is probably going to be better for you than supplementing.
Sure. You get it all rather than pieces.
Exactly.
How does one determine whether one has a prostate problem? I mean, are there symptoms?
Very good question. Some men will ignore their symptoms, and so it's very important to understand what these potential symptoms can be. Prostate cancer often does not cause symptoms until very advanced stages, where it can cause blood in the urine, difficulty with urination. Prostate cancer can spread to the bone, where it can cause severe bone pain or even fractures of the bone. So prostate cancer, but that's in the advanced stages. Now, how do you know? Often you don't have symptoms from prostate cancer. That's why it's very important to get screened for prostate cancer. And the way we do that is by a rectal examination and a blood test called a PSA. Stands for prostate-specific antigen. And in general, we recommend that patients get screened starting at the age of 50, once a year, with a blood test and a rectal exam, unless you have a strong family history, or if you're African American, which means you may have a higher risk of developing cancer, then those patients should start at the age of 40.
Well, has there been some controversy about the PSA test? Is it as valid as we've always assumed it to be?
There's been a significant amount of controversy. The U.S. Preventative Services Task Force, which is a governmental organization, has recently put out recommendations to stop PSA screening. Wow. The urology community, of course, is opposed to this recommendation. The main reason, prior to PSA screening, we lost many men to prostate cancer. Since starting PSA screening in the 1990s, we have seen a reduction in death from prostate cancer. Not only that, we prevent many men from developing advanced prostate cancer, which can lead to significant pain and morbidity. So there is controversy. The reason there's controversy, PSA, we admit, is not the perfect test. However,
but we don't have anything better.
In the absence of something better, we have nothing to detect prostate cancer early. So if we get rid of PSA, we go back to an era where by the time they come to see me, it's too late. Those patients already have advanced disease and would not be treatable or curable.
So what do you tell your patients if they come in armed with this information and say, well, I heard the PSA is not that great, but what do you tell a patient?
Good question. Some patients you are not going to be able to convince, and they're going to interpret things their own way. However, as a urologist, we recommend PSA screening. We recommend early detection of prostate cancer. I don't think the problem is actually checking the PSA. The problem arises when you have the diagnosis of prostate cancer. Then I think it's important to have a discussion with your urologist to talk about the treatment options, to talk about the pros and cons of treatment, and then make an educated decision as to whether you want to actually get treated or not.
Let me ask you to kind of sum up what you think men ought to do, especially those of us who are over 40, maybe over 50, and what do you say to the wives and the girlfriends to spur that along to get guys to go in and get checked up?
I explained to them that the various treatments we have for problems related to the prostate have come a long ways, so that some of the side effects that people were concerned about in the previous era are not as much of a concern. Prostate cancer surgery has completely changed. Everything is geared towards minimally invasive therapies which allow patients faster return to work, less pain. Often patients barely stay in the hospital, they go home, their recovery is much quicker than it used to be. So it's not as much of a fear for many people.
It's not the death threat that you
be.
think of when you think of cancer.
Exactly.
Well, doctor, thanks for coming on and joining us. Enlightening. We hope you'll join us again.